Also, we're hearing a lot about using TfL. Everyone knows that the tube and the bus is not our new blue light ambulance service. They tell you if you're not feeling well enough, would you please get off? You can't even give money on there now, so what about vulnerable people? It seems to me we're all going to get motion sickness just being churned round and round. And what about child protection issues and those people facing domestic violence? Who do they see? Who's the main person? Anywhere around the hospital. Thank you.
So I'm a GP in Shepherd's Bush, and I work with Bush doctors, and we have a considerable proportion of our patients who live in White City. And I agree completely with you, there's a high level of need in a lot of the residents in that area. And there's a number of our patients there as well who have difficulty accessing services because they don't speak English as a first language, etc., etc. I think the CCG is aware of the level of need. One of the reasons for developing the Parkview Centre was to try and improve access to services for patients living in that area. And I know it's only relatively recently opened, the services have only relatively recently moved in there, but what we are hoping to provide from that centre is an integrated form of care where patients find it much easier to access the services that they need.
But they still won't have an A&E service, really, will they?
No, the A&E service will not be provided for the Parkview. No.
Services they're crossing over into Brain.
Just to talk about transport for a moment, if you would bear with me. So we've already talked a bit about the fact that we recognise that there are patient groups who find it very difficult to navigate transport. And they find it difficult to navigate not necessarily because of their medical condition, but because of other issues, whether it is language issues or financial issues. We and the Trust are aware of that, and if they attend the urgent care centre and need to be transported elsewhere, they will be giving support in doing that. I think that the question about child protection, to be honest, the child protection, Hammersmith Hospital already is not a centre for paediatric care. The ED department, the emergency department there does not see or treat children. So from a point of view of child protection, what the advice would be to attend your GP surgery or to attend St Mary's or Chelsea and Westminster where there are larger paediatric departments. So I really don't think the closure of the ED will cause any knock-on effect in terms of child protection.
I think if there's an accident or anything with a child, you get them to the nearest place where they need help. And I think that to say that we don't take children when there could be a child protection issue is really on very, very dangerous ground. I'm sorry.
I think Ruth will probably be able to give more detail on that, but the current situation as it exists currently is that the emergency department at Hammersmith does not see or treat children.
Thank you, yes.